Hi, my name is George Fodenakis, and this video, even though it's going out to a lot of my subscribers, this is not my typical video for this channel. Normally I do things with woodworking and little construction things around the house and helpful hints. This one is more like a public service announcement because recently I was diagnosed with prostate cancer, and I was led to finally use something called the TULSA procedure to remedy that situation for me. And I was looking online prior to having this procedure done, and it's fairly new, and I was not able to find a lot of information. So what I'm going to do in this video is kind of give you an outline of the TULSA procedure, what it stands for, what it does, what I went through, and see if it might be a good solution for your particular situation in your life. If you are not at all involved in this kind of a decision, it's probably a good idea to just turn this video off because it won't be of any interest to you. First of all, how about a definition for the procedure? It's spelled like Tulsa, like in Tulsa, Oklahoma, but it really stands for transurethral ultrasound ablation. And what's unique about this procedure, I guess Medicare just approved it at the early part of 2025, but the procedure is a non-invasive procedure. There is no cutting involved, and all of the eradication of the cancerous tissue is done by ablation, which is burning away through ultrasound. To give you some more details about the particular procedure, it is done by putting a probe into the urethra up to the area of the prostate and then projecting ultrasound into the prostate and bringing the tissue up to 130 or 40 degrees Fahrenheit and causing the tissue to die. And that ablation is permanent for that tissue. You might think this sounds very painful, but all of this is done while you're sleeping. I want to show you a diagram here of what it looks like as you're going into this TULSA procedure. Take a look at this and it'll give you a better idea of what's going on. Here you can see the patient being slid into an MRI machine and prepped for the procedure. Now, after you've seen the picture of the TULSA procedure, I want to kind of give you an idea of why I decided that this was an appropriate procedure for me. First of all, in order for this to be a very effective procedure, it works best on prostate cancer that is in the anterior area of your prostate. There's a different procedure used for posterior area, and that is done through the anus area, but this is a little different. So I had cancer in the anterior area, and it could easily be reached by this technique. And the other thing to think about is if you are also suffering from an enlarged prostate and having difficulty in urination, this procedure can be used for that. And in my case, and in many cases, you get a twofer. And what I mean by a twofer is that you can have this procedure done, and when the procedure is done, it will eradicate the cancerous area in the anterior part of the prostate, and at the same time, it could decrease the size of your prostate and allow you to have easier urination. And so that was what I was going for. Now, a little bit about the procedure as I remember it. I had it 15 days ago, and you can see I'm in pretty good shape today. But I went to the hospital. The prep for the procedure was really involved. I've prepped for having colonoscopies numbers of times, but this was more involved. I guess they needed more clean slate to use. And so the prep for it involved no solid foods for 2 days. So it was liquid diet 2 days out. And so my last meal was a Saturday night and my procedure was a Tuesday morning. So not only did I go 2 days without any solid foods, but the day before the procedure, I went through the drinking of the fluids that cause you to, lose all your waste. And that was done in the morning. And then I was clear by noontime, but then I had to duplicate the process the evening before the procedure and do it all over again and end up with an enema. So when I went into the procedure the next morning, there was no water overnight. And when I went into the procedure, I was feeling okay. I went to the hospital early in the morning, and the anesthesiologist told me that in order for this procedure to be done, I had to be totally paralyzed. I couldn't move a muscle during the procedure. So he said he was going to knock me out and intubate me so I wouldn't be breathing on my own. And he assured me he'd take good care of me, and he did. And so when I went into the procedure room, I went into a room where there was an MRI machine, and it was interesting. I counted 8 people in the room. All of them were involved in different aspects of this procedure. I went in and I was given drugs intravenously that knocked me out, and the next thing I knew, I woke up about 3 hours later in a waiting room with my son sitting next to me. Now, what took place while I wasn't aware of it is after I was sleeping, I was strapped down to a table and the probe was inserted through my urethra. And after it was inserted, I was then also had another probe inserted through the rectal area that had cooling fluids running through it. Now, the doctor was sitting in a separate room, and while he was sitting in that room, he was able to see my prostate through the MRI machine that I was slid into. Now, as he viewed that prostate, they injected contrast fluids into my body. So the areas that had the cancerous lesion kind of lit up, and then he was able to take the TULSA probe and move it in such a way, almost like a fan, and slowly ablate the tissue that was suspected of having cancer. And while he was doing that, they also had instrumentation that allowed the doctor to see the temperature within the prostate every 5 seconds. This diagram shows 12 different transducers that independently show the temperature as the procedure is taking place. Here you see the sweeping arm of the instrument gently burning away and ablating the tissue in a circular manner. And down below you can see how different areas are lit up, and it shows where there is still blood flow, and as it is ablated, the blood flow is destroyed and the tissue dies. So in an area where there are nerves, the urethra, parts of the rectum that they did not want to heat up, those areas were monitored closely, so there was no suspicion of a higher temperature going on there. If so, they would have cooled it down quickly with fluids pumped in. So that procedure took place. It seemed like a slow procedure. And I was warned ahead of time that on people with very, very large prostates, sometimes they cannot get the probe in. My prostate was at about 122 milliliters of volume, and the doctor said he had trouble with someone that had a prostate of 150 milliliters. So the size and the doctor will determine whether or not you can even have this procedure. When I came out of the procedure, I was kind of out of it, but my son was told that the procedure was successful, that the tissue that needed to be ablated was ablated. And this MRI image shows the ablated area, and the volume is about that of 1.5 golf balls. So this is a big area that has been destroyed. And so I was sent home with a catheter, and I think the most negative thing about the entire procedure was the catheter itself. I had to have it in for 10 days, and I was informed that because instrumentation had been placed inside of me, that the tissue swelling after the procedure sometimes doesn't allow you to urinate properly. So they were able to catheterize me for that to take place. After 10 days, that catheter was removed and urination, in my case, came back simply with a little bit of bleeding still, and absolutely no pain from the procedure itself. I would suspect that after they removed, I found out 64 milliliters of the 122 milliliters size of my prostate, that there would have been some pain there, but there wasn't, no pain at all. So I took antibiotics. They didn't want a urinary tract infection after the procedure. And then, so right now, I'm just kind of taking it easy, not lifting heavy things. I do have an urgency to urinate afterwards, and I am scheduled for an MRI in 1 month, and they will again take a look at the area that was ablated. So if you were asking me, would I do this again, looking at the current medicine that's available for someone in my situation, I would jump at the chance to do this again, because it did not destroy tissues that I wanted protected. It seemed to have ablated a large portion of my prostate where it was suspected to have cancer. My urination has already improved, even though it will continue to improve. So yes, I would do this again. I think what you're going to have to figure out is this procedure involves technical equipment, technically trained doctors, and it seems like it's kind of hard to get to those two things. You're going to have to be near a large city and find doctors and equipment that can actually do this in order to have it. It seems to me that this procedure is going to be more and more readily available because now Medicare is covering it and more doctors will be trained in it. So if you have any questions on the procedure that I had or any other things like that, please down in the comments, just send me a question and I'll try to respond to you as best I can. So I hope that gives you kind of an overview of what you're looking at if you decide on a TULSA procedure. Make sure you talk with your doctor and explore other possibilities that may be better for your particular circumstances. But for as far as my circumstances, I had a Gleason score of 3 + 4, 7, but also had, it seemed like, a pretty aggressive lesion that was growing in the last 9 months and difficulty urinating. This was perfect for me because it solved both of those problems in one procedure that I basically went home from the same day after 3 hours or so into the procedure. Thank you for watching. I hope this inspires you to look into it, possibly even use this procedure in your future if it fits your particular case. Have a good day. Bye-bye.